pregnancy is gonna happen anyways, so just don't stress about it.
Would we get to a point where a woman in her, 60s, she would decide to have a kid?
Just have the plan B for you. Have your eggs frozen, have your eggs ready for you whenever you need to, just in case you want to use them.
But what about the way we feel? Like, what about our mental health?
The message from this is not to be shy, to go at least and talk to a healthcare professional. At least you will get tested and you will be checked whether there is something that will affect your life rather than even only for the sperm count.
What are the other misconceptions that you come across?
There is a misconception that if once you try IVF, you can never go back to natural conception. That's not true at all.
How can we shift the conversation about fertility to empower women rather than to pressure them? In today's episode, we are thrilled to have Dr. Ruba Masafeh, a highly skilled obstetrician and gynecologist with a deep passion for fertility and women's health. With experience in both Jordan and Dubai, Dr. Ruba specializes in infertility treatments, preconception care, and overall reproductive health. We'll be discussing the journey of fertility, the importance of mental and physical well-being, and how these factors play a critical role in achieving reproductive health. So join me in welcoming Dr. Ruba.
Hello, Anara.
How are you?
I'm good. How are you?
So good to have you today.
I'm so happy. Thank you for inviting me over. I'm really, really honored by this invitation, and thank you for having me on your show.
You're most welcome. We are honored. So, Dr. Ruba, we're going to focus on fertility today.
Yes.
So I'm going to ask you, what is fertility? Can you explain what fertility is and what it means for a woman's overall health?
Okay. So fertility is the ability of a woman to conceive and bear children. And usually it is like considered to be able to carry a baby until term. So that is fertility per se, according to the books. It used to be in the past the epitome of health for women is being able to conceive. So basically speaking, if a woman is healthy enough, she's young enough, then she's okay to get pregnant, and that is the definition of a healthy woman. That's how it used to be interpreted in the past.
Yeah, and now it's not
now
the
it's
case
a choice
anymore.
rather than
It's a choice.
rather than a destiny or your let's say mission in life.
Yeah.
Now it is a choice.
Yeah.
So many choices in life. So it is a choice, but it's still fertility
Is
keeps
important.
the same definition as being able to bear children and have a baby and conception until term.
Okay. So can you tell us what factors can impact the woman's ability to conceive?
Of course. So fertility is actually it's affected by many factors. There are female-related factors, there are male-related factors, there are combined factors, and there is also the unexplained ones. And usually speaking, that we let's say divide these factors into thirds. So it's like 30% women, 30% men, and 30% unexplained, and 30% combined, and 10% it's unexplained.
Okay.
So we're talking about it from a woman point of view. For a woman to be able to conceive, to be fertile, there are so many factors affecting it. First of all, her age.
Okay.
Second of all, it's her hormonal balance in the body. Then it's about more about organs and physiological health in terms of uterus, ovaries, fallopian tubes, the things that will help to conceive and to carry on a baby until term. And of course, there are other factors like socioeconomic status, if she's being able to conceive and to afford that. And that is also being one of the reasons of maybe less fertility in some women.
Fertility, or they decide not to have them just because they don't have the means to?
Actually, yeah, it's not a decision if you don't have the means for it. It's just like you being pushed not to, or you're opting not to go for that one because maybe you can't afford the treatments. Because honestly speaking, fertility treatments, they are one of the, let's say, one of the most expensive treatments in the medical field, along with cosmetics.
Yeah.
But cosmetics is another choice of life.
Yeah, still.
And this one as well, now I think to be able to afford to have a child and to bring them up, it's also something that will affect you mentally, physically, and of course, economically.
Yeah. And going back to the social part,
Yeah.
especially when it comes to age, we can't talk about fertility without mentioning the age.
Yeah.
So how, from your perspective, how does age impact fertility? And especially with today's technologies and advancements.
Yeah. So, well, according to the books and according to the science, women is most fertile in her 20s, late teens to late 20s, and after that it's downhill. So the most fertile, let's say, we calculate the fertility rate by conception rate per cycle. So for a woman who's in her mid-20s, let's say, until late 20s, she has a 20 to 25% of getting pregnant per cycle. When she's between 30 to 35, that's going to change from 15 to 20. And then in 35 to 40, that's going to be about 10 to 15%. And after the age of 40, beyond the age of 40, it's going to be only if it's going to be good if it reaches even 5%. So it is a very determinative factor and from age point of view. But also we don't want to say that, oh, you're getting maybe 35 years old, you need to go and have a child. It's not like that, but it is just what statistics say, that your chances of getting pregnant are at highest when you are in your 20s.
Right.
And that also reflects on that means even your eggs, and from a healthy point of view, from quality point of view, they are at their best at that age.
And what about lifestyle? Does it have an impact,
of course,
effect on fertility?
Of course. So it's also the age factor that we cannot control.
Right.
That's not in our hands.
Right.
But something that's in our hands to be able to let's say to improve our chances of getting pregnant or to enhance the chances of carrying a successful pregnancy till term, we can always go for healthy lifestyle modifications. From healthy diet, we're talking about whole food, no processed sugar, no refined sugar that can affect us in let's say, on so many levels actually, especially from diet point of view, because one of the causes of infertility is someone to have polycystic ovaries. And polycystic ovaries, it is closely correlated to insulin resistance. So the more you have carbs in your diet, the more you have sugar in your diet, that means your ovaries are not working well. The quality of the egg is going to be poor. So to be able to be having like a wholesome, let's say, life choice, it's to cut down sugar, no refined sugar, eat organic whole food, add to your diet from the healthy fats, the healthy proteins, exercising. Some people saying, yeah, well, I kill myself at the gym. This is also wrong, because obesity affects it in a bad way for fertility because of the poor quality of egg, because of the insulin resistance, but also being overactive, being underweight, that means you don't have enough fat in your body for the hormones to work in your body. So not overdo it, not underdo it. It's all about balance. Of course, smoking, recreational drugs, alcohol, that all affect the quality of the egg, even if you are in your, let's say, mid-20s. But if you're going for that, that means the quality of your egg is not really that good.
Good, okay. What about the quality of sleep?
Of course, stress, stress, quality of sleep. It will all reflect on your body, actually. It's not only, so people say that your looks sometimes reflect how your body looks like, and we know always say, oh, we need our beauty sleep. So it's a good quality sleep, stress-free life as much as possible. This will help also to, as it looks from the outside, you're radiating, that means also things are going well from the inside. So it is also an essential part for that. Even meditation, the spiritual aspect of that, as the more you're calm with your body, the more you're calm with your environment around you, with the people as well, that all will make the stress levels, the cortisol levels, to be a little bit more or less in a level that it will help you to conceive rather than working against you.
Okay. And other than what I just heard about sport, about not overdoing it, because that's not good for fertility, which I never heard before. What are the other like misconceptions that you come across around fertility and infertility?
Well, because we are in this part of this region, so I'm gonna talk about the most important one, and I think it's being people do not talk about it that much. That fertility is always the woman's problem, which is not.
Yeah.
As I said in the beginning, it is thirds actually, male, female, and combined. So when we talk about IVF, like these are the new trends, the fertility techniques, the assisted reproductive techniques, they were actually developed to address male fertility more or less, because for that for a pregnancy to happen, we only need one good healthy sperm. So people they tend to how to say it, like to undermine women and say, yeah, it's only a woman's problem. She's getting old. She's not having regular periods. She's having polycystic ovaries. So it must be her. Actually, that's not true at all. So even from a male point of view, if he's not also exercising, if he has a big belly fat, smoking, drinking, that also affect the quality of the sperm. And sometimes
belly fat?
Yeah, of course. Okay. That means with the increased body mass index, that affects actually fertility in two aspects. The quality of the sperms that they are being formed, and actually the sexual function of the person. The more belly fat they have, the less desire they have, the less libido, and the less sexual performance they can have, and that can also cause erectile dysfunction. And without that, you cannot get pregnant naturally.
Right.
So people say, "Oh, it's okay. You're a guy. It's fine. You will never ever stop producing sperms," which is true. But even for guys, at the age of 40 to 45, the quality of the sperms also tend to decline. So it's not only females who are getting affected by age, but also males.
Males. Okay, that's interesting.
And this is what's happening here in the Middle East. So let's say that a couple have been married, and they start like, when are you gonna get pregnant? When is your family gonna grow into like 3 or 4?
Yeah.
Look at your cousin, look at your friends, they are all pregnant with children.
Yeah.
So you feel that kind of pressure from the community around you, and they always blame the woman, like, go and get tested. Okay, what about him? Exactly. Why not get tested? But now I think with more education about things, fertility centers are being, mashallah, they are like as many as cosmetic clinics here. I think people are more aware of it, but there is still, from male point of view, the stigmata of going to a fertility center to get tested, to see like, oh, I'm not masculine enough to produce children. This needs to be a little bit broken into science that, even if you're healthy enough, if you're smoking, if you're drinking, this also can affect the quality of the sperms, and this can impact your fertility and desire of having children.
Yeah, and it feels like somehow it's like a taboo when people are dealing with fertility issues. Like when you're dealing with other issues, when you're having a problem with your stomach, I understand that it's a bit more intimate, etc. But there is a taboo around it. Like people wouldn't share their concerns when they're having issues with fertility. They wouldn't share it with even close friends, and it's not the same way as I would share about something else, and especially from a male perspective. From
a male perspective, yes.
Yeah.
From a female perspective, I think women in this issue, we're a little bit like sharing experiences, being able to go to a doctor, a gynecologist who can just also explain this. I think it's a little bit for the information. It can be handed easily to women rather than men.
Right.
For men, I think they feel lost. If I talk to my friend about this, maybe he'll think I'm not a man enough.
Right.
Or maybe they will think of other issues, like if he's not able to produce sperms, then he's not able to function in other ways.
Mm-hmm.
So let's say if a female is going to a gynecologist, maybe for male is to go to a urologist and to discuss all these things. There are so many causes for male infertility. As I said, lifestyle, bad lifestyle habits,
Right.
but also it can be a hormonal thing, it can be a congenital thing, sometimes varicose veins in the testicles that can affect their impact, and that can even affect their life as well. So it's, let's say, the message from this is not to be shy, to go at least and talk to a healthcare professional. At least you will get tested and you will be checked whether there is something that will affect your life, rather than even only for the sperm count, or whether I'm able to impregnate my wife to get pregnant or something like that.
Yeah.
So it's better to go and have someone to talk to, better if it's a healthcare professional, rather than listening from here and there. With these kind of myths and misconceptions, like, oh, you haven't got a child now, you'll never get pregnant, you need IVF. And if you need IVF all the time, one time you're going to need it all the time. These are some misconceptions in that you can actually hear it and then believe it if you don't go and look for the truth behind such things.
And I've noticed one thing is, people, like, when they get into relationships and they're discussing about their, plans to get married and have kids, they wouldn't consider, going and actually checking to see if they can actually really if it's physically possible. I mean, people get, especially at a certain age, it's taken for granted that, okay, I'm in my 30s, I won't have any problem. And then they go into it, but they don't really check. And we don't have, as women, generally, I'm not talking about men because it's different with the urologist, but for women, we don't have that tendency to check ahead to see where we're standing when it comes to fertility before we start conversations and planning ahead, when it comes to relationships and marriage and having kids, or, having a family.
Well, this, I do agree. We don't talk about this much. And so many patients, whenever they come and visit me, I ask them this question, do you see yourself as a mother in the future? I don't say, do you want to get pregnant? Let's get you. Do you see yourself as a mother? Because the most important thing is that you should know that this is a choice for you. It's not that your mission in life is just to get pregnant. I know this is a controversial issue. Some women, they just don't have partners. Some women, they just choose not to. But some other women, which is the majority, that they want to get pregnant, but at a later stage of life maybe. So this has, let's say, a pros and cons. If we do and tell them that, there is a fertility test, you can just go and check. And what if the test comes back with let's say, disappointing results? You're going to be like in your early 30s with disappointing fertility results. And like, do I just go into this relationship just to get pregnant? Or what to do? Should I go for egg freezing? Should I just forget about it and not get pregnant at all? So this is what it can cause some extra stress for you. And but also not to know, like, I'm in my late 30s and I'm ready to have a baby now. And then when I'm trying, and then I go to the doctor and like, we're sorry, your chances are super low. And like, why nobody told me that before? Right. So it depends, as I said, on how a woman sees herself in the future. If you see yourself as a mother, you want to have your biological family and you want to have a chance at that, just go and have a check with your doctor and see what test they have to provide. It's more or less the same test. We do it on the second or third day of a period. One of them is the ovarian reserve. It's called anti-Mullerian hormone. Some of them is the follicular stimulating hormone, luteinizing hormone. That's also done around period time. Also with the ultrasound to check the ovaries, to have an egg count, just to tell you that, you're okay. And if you want to wait, you can wait. But it differs, as I said. It depends on whatever you see for yourself in the future. Is it okay to do it? Yes. But is it fine to be over dramatic about it? Better not, because more or less, most issues in fertility, we have a solution for that. We have a solution for that. As I said, also it depends on how you see yourself having a family in the future. So, like, first and foremost, for the fertility issues, is that you want to have your own family.
Right.
So whether it's through natural conception, whether assisted reproduction, whether it's adoption, surrogacy, whatever your plan for your having a family, that affects on how soon you should go to the doctor or not. Generally speaking, again, going back to the books, we say when to go and seek, when to suspect that there is a problem. So if you are below the age of 35, if you're trying to get pregnant with having unprotected sexual intercourse for a year and you're not getting pregnant, then you should go and see a doctor. If you are above the age of 35, this year period, it is reduced to 6 months. Because that means there is something wrong, whether with you, with your partner, or maybe it's, as I said, that's unexplained. That means keep doing the same thing over and over again and not getting a result. It's also not a good choice to continue with. It's not like, oh, God did not have it for me in the books not to get pregnant. Well, science has evolved. Science is having more and more advancement in these fertility issues. So I think going by this rule, like whenever I have a female patient coming to me at 3 months just of trying to get pregnant, I'll tell her, well, let's review your calendar. Let's see how regular your periods are, if there are any symptoms that I can pick up to see if there is really a true problem that's being from the examination or from the history itself. If it's fine, I'll tell her just go and try for a few months. But if it's like more than a year and you're not getting pregnant, then we need to act. There is something called unexplained infertility, which is IVF and IUI can address this issue. And as I said, there's a misconception that if once you try IVF, you can never go back to natural conception. That's not true at all. So maybe it can just help us to get pregnant and get that pressure off your shoulders. But for next time, maybe also you can get pregnant on your own. And we've seen it happen with so many patients.
Right. And can you share with us the latest advancements when it comes to IVF and IUI?
Well, IUI is not really, there is nothing much to it for in terms of intrauterine insemination. It's where we get the sperms, we wash them, concentrate them, and then inject them in whenever it's time. In a female's body. The IVF, that's where the advancement is being happening. So it used to be conventional IVF where we bring the egg and we bring the sperms around it, and whatever sperm gets into it, then that's it. And sometimes eggs are not fertilizable, we just leave them alone. Now there is something called ICSI, and where they put the sperm inside the egg and try and see what embryos can be formed. There is also it got advanced that to a point that we can test the embryo before transferring, especially that most patients who go for IVF, they are in their late 30s, early 40s. So that means they have a higher risk of having abnormal babies because of poor quality eggs. So we tend to test the chromosomes then. And so we do test the embryos for any chromosomal abnormalities, and we transfer only the good ones. Also for a really good, in our part of the world, a really good use of embryo testing with the PGT, that we can also pick the gender for family balancing. Like if a family is having like 4 girls or 4 boys and they want another baby from the other gender, that also can help in that.
And that's using
IVF? Yes, with embryo testing.
Interesting. And where do you think the future is heading? Where are we heading now? I mean, would we get to a point where a woman in her, 60s, she would decide to have a kid and she'll still be able to?
Well, I've read about having an extra corporeal pregnancy, like where the pregnancy is happening in cods or in pods outside. I'm not sure how close we are to this, but I think what actually is the science is focusing at the moment is about how to lengthen the fertility periods. So we're talking about egg freezing, about ovarian tissue freezing, sperm banking, and how to, let's say, for unfortunate women, let's say, that's, I think, the challenge now. You are young, but unfortunately you've been diagnosed with premature ovarian insufficiency or premature ovarian failure, where you are young, but you're not able to have menstrual cycles, you're not able to have to have children. So this is where it's shocking sometimes, like, yeah, we're sorry, you cannot have any more children. And this has so many reasons. 50% we don't know why. Some of it is autoimmune disease, some of it is if there was a surgical removal of one ovary or the other during surgeries, radiation exposure. So for these, if they want to have a biological child, it would be a little bit very challenging. So now science is going towards PRP, platelet-rich plasma, and stem cell therapy for these ovaries, maybe to stimulate them, maybe to help induce eggs and to induce ovulation from such, let's say, poor quality ovaries. That's where the science is heading, to prolong the fertility of the human being themselves, rather than getting something extra from outside. So for these premature ovarian failure, we give them the option to go for egg donation. Of course, it's not allowed in this part of the world, but it is an option for them. But if someone who really is keen to pass on their genetic material, then yeah, PRP, stem cells, that's where the future lies.
Okay. And that's with their own cells,
with
right?
their own cells, yeah.
Their own, okay. Okay. And you were talking about, so we mentioned it a few times earlier about the stress that this adds on women. So how important is emotional and mental health from, during fertility treatments? Because this adds a lot of pressure on women, especially.
It is. It is super important to have a supported environment around you, whether it's family, whether it's friends, or whether even it's a Facebook group or something that you can go and talk with a therapist about this. You need to have that kind of support. And it's double when you're undergoing fertility treatment, because you're taking tons and tons of hormones. People may suspect that you're being just emotional and crazy. But it is actually part of the treatment. If you also believe hard enough that it's going to happen, then it's going to happen. Also about the, let's say, the aura, the vibes around you during this process, because it's not easy. It's not easy getting injected in the tummy every day, multiple times. And maybe at the end of the road, they will tell you, we're sorry, you did not even produce enough eggs. So even failure in such treatment, also that needs extra attention and extra care. And there are so many now psychologists who are only specialized in supporting any woman or any, let's say, couple even. They're going through fertility treatment, because their concerns and their problems, they are genuine and they are valid. So if you tell your mother, maybe she'll say, oh, come on, you're just going it for the baby. But is it worth it to bring a child into a home where the mother is not mentally stable, or maybe she's having second thoughts, or she's not really able to handle herself before she handles a baby? So we need to be at least be there for them. We can, as I said, there is a very big community out there. There is the Facebook groups, there are the friends and families. They can help with such, at least to have that mental stability.
And I'm going to go back, because we mentioned earlier the age and social kind of, factors. What about stress and mental and emotional health when it comes to fertility? Besides because we have the lifestyle, we have the age, but what about the way we feel? What about our mental health if we're, we're living a stressful life, or, we're having fights with partners every day, or we have a horrible boss at work, or, does that have an impact?
Well, stress in life causes higher levels of cortisol in the body. And higher levels of cortisol, that means also higher insulin levels. And that can adversely affect your eggs quality. And even not only that, we say that when you are really stressed, your muscles are tense, and even let's say as a reproductive system in the body, it's not only the ovaries, it's also the ovaries, the uterus, and the tubes. And to be able to conceive, you need the sperm and the egg to meet to meet up in a healthy environment, and that happens majorly in the tubes. So the tubes, they are a muscular organ, and they keep moving freely in the body. But if you're stressed and tense, that even stops. Even the small cells inside the tube that help the egg and the sperm to meet, they are called cilia. Once you are stressed and you're very tense, they're not going to be able to help with the meetup of these two important things to get pregnant. So that also affects it in a negative way. Not only, so mentally you're affecting yourself bad physically. So it's going to reflect on your body in a way or another, other than just, high stress cortisol levels. So even when I'm telling my patients, you need to go and let's say we're tracking their ovulation and we tell them, tonight is the night, just go wild. We tell them not to really stress about it because yes, we know that ovulation is happening. Yes, you're gonna go and try for it. If you're stressed enough, your body will not react in a good way for that. So just let it happen. You're doing what you have to do. And let's say in Arabic, say ala Allah. You're just doing your job, you're doing your homework, you're taking the supplements, you're tracking your ovulation, and the rest, just leave it. If it happens, it happens. If it doesn't happen, there are so many other options that can help you. People can get pregnant in a way or another. We say that for many couples, they are trying to get pregnant, like if we have 100 couples, within a year, 80% of them, they will be pregnant. Within 2 years, 90% of them, they will get pregnant eventually without any intervention. So we are only left with 10% that's where they have really big problems or that we need to address their issues. So pregnancy is going to happen anyways. So just don't stress about it. It's going to make you age in a very advanced way with wrinkles and stuff.
Yeah.
So at least to have that beauty for you.
Yeah, exactly. Enjoy it.
And
we get wrinkles after we conceive babies?
Oh, no. Maybe it's just because you're not allowed to use Botox.
Okay. Is that the case?
Yeah. These are some cosmetic procedures that they cannot be done while you're pregnant.
Okay. Okay.
So make sure that you do your Botox, you do your fillers, and then you can go get pregnant.
That's good. A good piece of advice, because I was about to ask you now if you have any tips in terms of supplements or what we're supposed to eat or avoid, or especially supplements, because it's now where most of us are not getting enough from the food that we're having, so we're going towards supplements more and more. So
to be honest, I'm more into a food-based supplements. That's what I really like. So when we are talking about fertility has been declining since 1950s until now, and people, let's say, we attribute this decline in fertility just because of the goals have changed now. Not everybody is looking for a family, for the stress that we're having, for the all exposures and hazards that we have around us, the unhealthy food, the radiation, the autoimmune diseases that are being on the rise. So from a fertility point of view, yes, it's been declining, but for us, how to counteract this? With a healthy diet, again, with the exercising, not overdo it, not underdo it, just the right amount of that.
What's around the right amount?
It's like 3 times a week, 3 to 5 times a week, but also not to kill yourself in the exercise, just to have like that balance between cardio and weight training, especially for those who are above the age of 35. We need to build down muscles because that's what's gonna keep us going later on in life.
Okay.
So these set aside with the healthy lifestyle as well, like no smoking, no alcohol, with the recreational drugs to stop them. From a supplement point of view, there are some supplements that we need to have to prevent, first of all, to enhance the quality of the egg, to increase the chances of conception, and to lower the chances of having abnormal babies. So the most important one is the folic acid. That can also be found in food, but also this I like to give patients as tablets. And it's better if you stock on it 3 months ahead of your plans of getting pregnant, just to have enough stores in your body to, as I said, to enhance the quality of the egg and to minimize the risk of having a baby with abnormalities like a neural tube defect, or like anencephaly that we need to terminate the pregnancy later on for this reason. So folic acid is good. vitamin D is really essential.
Okay.
For those with polycystic ovaries, the inositol, it's a type of B supplement, vitamin B. It also helps with insulin resistance, and it helps with enhancing the quality of the egg. The zinc, because of the immunity factor, and the CoQ10. It's an antioxidant that helps to fight off the radicals, the free radicals in the body, and it will enhance the egg quality as well.
Okay. And these supplements we can actually take, I mean, we don't have to be, conceiving at that point. We can actually start taking them earlier on,
and also for your healthy lifestyle. So people say, oh, I'm finished with my folic acid, what should I do? Or I've done with my folic acid, what should I do with the rest?
Right.
Well, it's good for the hair.
Yeah.
So you can just keep on going. It's gonna help all your, let's say, to improve your health all over together. Yeah. So as I said, with the immunity, with the energy level, with the vitamin D, with the health of bones and stuff, it helps you to build up a healthy body. That's also on the plus side that's gonna help you to conceive as well and to get pregnant.
Right.
So it is something that's really good. But as I said, everything in balance is really good. So not only depend on supplements, also you have to go for the healthy lifestyle with the food, and also to drink enough water, because putting all that stress on the kidneys while you're not drinking enough water, you're just damaging your body.
Right.
So you need to, whatever is coming in, most probably is going to come out, but you need the mechanism and the way of doing it with drinking enough water for that. More.
When it comes to food, for example, some sort of, I don't know, is it better to have meat or more green in our, diet, or?
Well, we have to have a balanced diet. So you need the protein part. Not necessarily you have to eat meat for that. You can also go for vegan source proteins if you are a vegetarian or a vegan. So that's the most important part, the proteins, because also they have the vitamins in them, and which is the B complex part of it, and also the greeny leaves. But rather than that, it's actually the type of meat that you're eating. So it's like grass-fed beef. It's better than the ones that they put and they feed them, I don't know, whatever, with the hormones and stuff. So it's better to go for organic food rather than hormonized sources of food. We know that sometimes chicken, they just inject them with hormones to get them a bigger weight. So better to go for all natural, all organic type of food. I know it's a little bit more expensive, but if you are really planning on getting pregnant and it's not being an easy option for you, you have to go the whole 9 yards.
All the way.
You need to do whatever it takes just to be able to have a real chance of getting pregnant. Yes.
Okay. So this is going to be my last question for today. Okay. So how can we shift the conversation about fertility to empower women rather than to pressure them?
That's a really good question. So whenever we talk about fertility, it's a really deep and personal topic. So many complexities go into it. Women need to understand that there is no pressure. Nobody is pressuring you. It is, as I said, it is a choice once and for all. So when we need to talk about these things, when we want to address these issues, women need to be really well informed rather than only having the misconception and whatever she's hearing from here and there. She needs to have that information ready, available, easy accessible. And she knows that she also needs to know that she can choose whatever she wants in a well-supported environment without any judgment, without any pushing towards this side or the other. If you don't want to get pregnant, don't get pregnant. If you want to get pregnant, then you have to listen to the whatever the science is saying. But also, you cannot just approach it from one point. There are so many other points that we can go for it. But there is something that's called science-based medicine, and then there is something like, well, take this pill or take this plant, it will help you. Better to go for the science part of things before we go into shift into other things. So for this women, as I said, they need to know that it is a choice. You are well supported, no matter what your choice is, without any judgment, and just to lift this pressure off their shoulders. There is a million ways of having families, as we said: adoption, getting into a new family, surrogacy, egg donation if it's allowed, or if it's something that you're willing to go for, or just stay without any children. Maybe your career is nice, good, yeah. If your career is nice, if you're having money, that's also really good. I would go for that. Children is not for everyone, especially in this time of age. With people being a little bit less responsible, they don't want to have children, and they are being more open about it. Like, no, I don't want to have children. So, yes, I understand you. I respect your choice, but be sure that you are that way, because some people, they say in their 20s, oh no, I'm never gonna get pregnant. I don't want to have children, and then they come towards the end of 30s and they're like, what have I done with my life? Why did not I go earlier for that? And when we tell them it's not possible to get pregnant anymore, then that's when things go downhill. So you need to be aware of your choices and conscious about it early on. As we said, we're giving you, we talked about the age, but it's not in a way or another to pressure you into going onto something. If you're not sure, that's my message for ladies. If you're not sure that whether you're going to get pregnant or you want to be a mother in the future or not, then go for plan B, which is to go for egg cryopreservation, where egg freezing, at least to have that option later on in life, whether you want to go for it or not. We used to give this option for cancer patients, for terminally ill, for patients with chronic diseases, until they get through some treatment, period of treatment, and then maybe they can use it. But now it is an option that's available for everyone to use. You want to get pregnant, you're not too sure, just have the plan B for you. Have your eggs frozen, have your eggs ready for you whenever you need to, just in case you want to use them. And who knows, maybe you're going to get pregnant on your own without even needing these eggs. But at least to know that there is some kind of, let's say, insurance for your fertility, just that it's there and I can go back to it anytime I want.
Right. And then when is a good time to consider egg freezing?
Anytime before the age of 35, because that's when, so usually speaking, women, they are born with a limited number of eggs. It's in millions whenever you are born. Whenever you reach adolescence, when you start having your periods, they are 400,000 eggs, and they tend to decline gradually. But once we reach 35, the decline is very steep, and it's like aggressively declining. So that's when the quality and the quantity of the egg is being affected. So my advice, if you want to go for it, at least before the age of 40, to have your eggs frozen. Afterwards, you can still go for it, but you're gonna have, let's say, you're gonna work double hard or double times to get the same results that if you've done it maybe a few years earlier.
Okay. Okay. Yeah, so that was extremely insightful.
Aww.
And I didn't know about the belly fat part. Now I do.
We should spread the awareness about this.
Exactly, absolutely. We'll get to talk about it more, but for today, I'm really grateful to have you on the show.
Oh, thank you.
Really happy to have you.
And thank you for your stimulating questions, to be honest. It kept the conversation going, so that's really good, and I really appreciate it. Someone who really wants to know about this. These are very nice questions.
Thank you very much. And we'll have some more. Definitely, I'm going to have you again here.
No problem. I'm available whenever you want.
Thank you so much. I appreciate it.
Thank you,
Doctor.
Thank you.
Thank you. Take care.
Bye-bye.